Multiple response. A nurse is providing education to a first-time mother about the stages of labor. Which of the following statements made by the mother indicate an understanding of the first stage of labor? Select all that apply. A. The first stage ends when my cervix is fully dilated to 10 centimeters. B. During the early phase, my contractions will likely be mild and irregular. C. I will need to start pushing when I feel the urge to push. D. Transition is the least painful part of the first stage. E. My contractions will become stronger and more frequent as I reach active labor. Correct answers: A, B, E. Rationale: the first stage of labor involves cervical dilation to 10 centimeters. In the early phase, contractions are mild and irregular. As labor progresses into the active phase, contractions become stronger and more frequent. The urge to push occurs in the second stage of labor, not the first. Transition is the most intense part of the first stage. Drag and drop. A nurse is caring for a laboring woman who is entering different stages of labor. Place the following stages of labor in the correct order of occurrence. A. Crowning occurs. B. Cervix dilates from 0 to 3 centimeters. C. Delivery of the placenta. D. Cervix dilates from 4 to 7 centimeters. E. The baby moves down the birth canal. Correct order: B, D, A, E, C. Rationale: labor progresses from the early phase of the first stage, 0-3 centimeters, to active labor, 4 to 7 centimeters. Crowning occurs during the second stage, and the baby is born as the baby moves down the birth canal. The placenta is delivered during the third stage. Case study. A 32-year-old G1P0 woman at 39 weeks gestation is admitted to the labor and delivery unit in early labor. She is 3 centimeters dilated, 80% effaced, and experiencing mild contractions every 7 minutes. The nurse knows that the patient is in the latent phase of the first stage of labor. Question 1. What interventions are appropriate for the nurse to perform at this time? Select all that apply. A. Encourage the patient to walk around to promote cervical dilation. B. Instruct the patient to start pushing with each contraction. C. Offer light snacks and encourage hydration. D. Prepare for an imminent delivery. E. Assist the patient with relaxation and breathing techniques. Correct answers: A, C. Rationale. During the latent phase, walking can help labor progress, and hydration and light snacks may be appropriate if the patient is not restricted. Relaxation techniques help the patient cope with contractions. Pushing is not appropriate until the second stage, and delivery is not imminent in early labor. How 4. Matrix multiple response. A nurse is teaching a class of first-time parents about the differences between the stages of labor. Match each characteristic to the correct stage. First stage, second stage, third stage. Cervical dilation from 4 to 7 centimeters, delivery of the placenta, transition phase, pushing to deliver the baby, characteristic first stage, second stage, third stage, crowning, X cervical dilation from 4 to 7 centimeters of the placenta, X transition phase, pushing to deliver the baby. Rationale: crowning occurs during the second stage. Cervical dilation from 4 to 7 centimeters occurs in the first stage. The delivery of the placenta occurs in the third stage. Transition happens in the first stage, and pushing to deliver the baby is part of the second stage. Fill in the blank. A nurse is assisting a patient during the second stage of labor. The patient asks when she will be able to start pushing. The nurse responds, "You can start pushing once your cervix is fully dilated 2 centimeters. Correct answer: 10 centimeter. Rationale: the second stage of labor begins when the cervix is fully dilated to 10 centimeters, and the patient can begin pushing at that point. These questions simulate various formats used in the NCLEX Next Generation exam, focusing on application and critical thinking regarding the stages of labor.